Hello, students. I am Indu Barala, and I'm a BIMA student at Glenburnie High School. BIMA is an acronym for the Biomedical Allied Health Magnet School, which is one of the magnet programs that the 8th graders can apply for in AACPS. Our program offers a unique insight within the STEM and medical fields, along with amazing opportunities to experience hands-on skills and activities within these said fields. Today, I am joined by my friend, Rachel.
Hello, I'm Rachel Raji, and I'm also a BIMA student at Glenburnie High School. Like Indu said, our program helps set a platform for students who wants to pursue a medical career or goal in life. We are joining you today to share a peek into a local business. How many times has an adult asked you if you know what you want to be when you grow up? I bet more than a few times. This is such an interesting question for students now since many of the jobs we will hold may not even exist today. When thinking about jobs that we may be interested in, we have to think below the surface, and that's what we want to do today.
Yes, Rachel, I agree. Today we are going to look at a local orthopedics office. Luminis Health Orthopedics is one of the medical providers located at the Luminis Health Hospital campus in Annapolis. When you think about an orthopedics office, Rachel, what comes to mind?
Well, I know that orthopedics focuses on the muscles and skeletal system, and I know that these doctors address problems like sports injuries and back problems. So when I think about an orthopedics office, I think about doctors meeting with patients in a medical setting.
Yes, me too. But there are many other jobs and careers that make an orthopedics office work. When patients arrive at an orthopedic appointment, they interact with many different professionals, carrying out many different roles that lead to the patient's full care. Today, we'll meet some of these professionals and learn a little bit more about what they do.
I am here at Luminis Health Orthopedics. I have been here for about 3.5 years. So my job is to be on the floor and help with x-rays with the team, and also to doing more like the maintenance of the x-rays and of the x-ray machines and things like that, and kind of help the department kind of run smoothly. So typical day in x-ray. So when I clock in, I kind of start the machines. So the machines, they need warming up because it kind of damages the machines if you don't give a nice little warm up in the morning to get our day started. And then I kind of go through the rooms and what rooms need stocked and all that kind of good stuff. Because we have about 15 to 20 doctors here at the orthopedic in Annapolis, and we probably do about 150 to 200 x-rays a day. So we go through patients and we go through a lot of material. So we just want to make sure those rooms are all stocked.
Good morning. I'm Shannon. I am a OPCC here at Orthopedics and Sports. OPCC stands for Orthopedic Patient Care Coordinator. A typical day for me, it's all about patient care. So I normally start my shift at 8 a.m. and it ends around about 4:30 p.m. And throughout my shift, I am answering the telephone, directing calls to the appropriate departments and staff members, checking the voicemail, scheduling and confirming diagnostic appointments, surgeries, and other medical consultations. I'm also operating office equipment, sending faxes, making copies, using the scanner. I do a lot of filling out short-term disability and FMLA forms, printing medical records for patients, sending prescription requests to them. We use a MyChart portal, which is an online communication system for the patients where they can send us direct messages. So I'm answering questions from them, routing patient messages to my provider, assisting my provider in clinic throughout the day, and making sure I demonstrate the eye care behaviors to improve the patient's experience. You definitely will need a high school diploma. You must be able to demonstrate basic computer skills and about 1 year of clerical or billing experience in the medical office setting. Medical records experience is strongly preferred, and definitely must have excellent communication skills because the bulk of my job is communicating with the patients and the providers.
My name is Brian Hartnett, and I am the lead orthopedic tech here at Loomis Health and Arundel Medical Center Orthopedics. And we're getting ready. So we're sending patients to x-ray, trying to expedite things, and I'm rooming patients. So I take patients back. So I take them from the lobby, I take them into the rooms, and I just ask your typical medical questions. I verify what they're there for. I see how they're doing or how they're progressing. If this is like a follow-up, they've been here before, and ask them just general questions, general medical questions, medications, and so forth, and just get them prepared for the provider to come in there. I send them for x-rays if I need to, and then we let the provider get in there and ultimately do their job. In a lot of cases, what they're looking for is, medical assisting is one pretty big one. So they like to see, maybe medical assisting, and a lot of our techs here, this is a stepping stone or a jumping off point. So a lot of our techs want to go on and they want to do something more in depth maybe, or they want to move up, like such as nursing. They take this as a jumping point into nursing, or a lot of techs take this as a jumping off point into going to PA school and those types of things. So really, we like to see some sort of a medical background.
My name is Renee. I am a front desk lead for Luminis Health Orthopedics. Like I said, I've been here 14 years. I've stayed in the office assistant role or department. We used to call it the front desk department. A typical day is, we come in and we usually prep for the appointments for the next day. So we're always a day ahead. So what we usually do is we have a whole stack of charts for the patients that are coming in. So when we come in the morning, what we do is go through the schedule, see if there's any appointments that have been canceled or anything that's been added, and, prep those charts, also going through into those individual patients' accounts, seeing if there's a referral needed, seeing what type of copay is required, and then just verifying some registration information. And then usually we'll start on the next day as patients are coming in, and we are able to check them in and get their insurance card and their ID, and if any referrals are required. And that, depending on how many providers that we have in this section, it could be a steady, very busy day, or it could be like a relaxed day. You don't have to have experience. I have a young lady that just started with us, and this is her first job in the medical field. So you don't need to have a lot of training, because we'll train you. And again, the office assistant role is a good a stepping stone.
So I'm Dr. Sharif. Obviously, I'm employed at Luminis Health Care. I'm a physiatrist or pulmonary doctor. So essentially, I am. So we have, it's mostly ortho, so surgeon. So not all musculoskeletal pathology is treated via surgery. So anything non-surgical, I'm the medical doctor that pretty much treats those things. And I will chart and go over every patient before I see them. Pretty much go over labs, vitals, like imaging, previous, like if they've seen another one of my colleagues, I like to know what they've already been told, so I already can kind of continue their thought in a way. And then also allows, when you're with that patient, that you're not staring at a computer instead of looking at the person or at the patient. Patients hate that, obviously. So it gives me the best opportunity to not do that. So then essentially we'll see patients, about 20 patients per day, more regular clinic days. And then you pretty much do 4 years of undergrad. You can pick any major for med school, but the typical ones is going to be biology and chemistry. But actually, medical school actually prefers you not to do that, to stand out more. So 4 years of that, and then you take your MCATs, which is your boards, and another 4 years of med school with boards in there as well. And then there's residency, another 4 years of that, with boards in that too. Basically, standardized tests are your boards. And once you're done with that, you pretty much get hired by a hospital such as Luminis Health. Like I said, when it came to training, because it's so much training to become a medical doctor, I wouldn't consider it as work. I would consider it as literally like growth. Like it's enjoyable to keep learning, because if you don't, the next day is the same as the day before. So if you don't change and grow, you're not getting anywhere.
My name is Kathleen Hilberg. I am a physical therapist and supervisor at our outpatient rehab clinic in Annapolis in the Belcher Pavilion. So we're on campus at the hospital, but we're outpatient. So patients make appointments and come in and then go home. A typical day for me as a physical therapist, we have scheduled for patients. So I have my schedules pretty much loaded up with different appointments and varying times and things like that. And so I have patients come in, I'm going to work with them directly, some hands-on work, whether I'm doing some manual techniques, stretching, some different trigger point releases, or some joint mobilizations and things like that. And then we get them through some exercises to work on anything from mobility, strengthening, coordination, overall making sure that they can get back to the kind of activities that they want to be doing, whether it's from an injury or a surgery, or they're just having general pain and they need to get a little bit better. They can't do certain things. They can't sleep because of the pain, whatever it really is, kind of getting those people back to getting through their daily activities, getting them back to functioning as to where they want to be in their day-to-day lives. We use all kinds of different equipment too. So some different modalities like electrical stimulation. We have traction tables. We have an altered G treadmill, which is basically a big treadmill with a big bubble that blows up and unweights your body weight. So if somebody's like returning to running or something, they can run without all of the impact of their body weight on there. Typical machines that you might see at like a gym, leg press and that kind of stuff. And then different ways that we then utilize things like resistance bands and weights that you might not even think of to challenge your core and strength and all of that. So in terms of my therapist side of things, that's really what I do day in and day out, have been doing for the past like 3.5 years, almost 4 years. From the supervisor side of things, I kind of manage and run the clinic. And so I manage the people who are in it, manage schedules, making sure that things are running the way they're supposed to, kind of process improvements to make sure patients are getting the best care they can, therapists are happy and all of that. So a lot of scheduling, meetings and that kind of stuff, but all of it together is really just making sure that people are happy and they can get back to doing the things that they need to do both inside work and outside of work. So physical therapy is a doctoral program. So you have to go through your undergrad and get an undergrad, a bachelor's degree. And then you have to do PT school is typically 3 years of undergrad or of grad school, sorry. And so after those 3 years, you'll graduate with your doctor of physical therapy. So in total, about 7 years. And then after that, you can get additional certifications and things like that. So I would say the best part is watching people get better. So you see patients come in and they're having so much pain that they can't even walk their dog, or they can barely get up on their own and things like that. And I think I speak for a lot of therapists when you say that, when we watch people progress over, and I had a patient recently who I was just able to discharge from therapy, that they don't need to come in, they don't need me anymore. But they came in a wheelchair that they couldn't walk. They couldn't put that pressure on their feet because they were in too much pain or they were recovering. So watching them getting back and taking those steps and watching, it's kind of like a baby. You see them take their first steps. It's your baby of your patient kind of. And watching them get better and make that progress and being able to go home and do all these things and not need you is super rewarding and makes you feel it's self-fulfilling that you've done this for somebody, you've helped them get there.
My name is Jeff Gelfand, and I am an orthopedic surgeon. My practice is made up of upper extremity surgery. I take care of conditions that affect the shoulder to the fingertips. I did my general orthopedic training a long time ago, and then when I completed my residency in orthopedics, which encompasses the entire musculoskeletal system, I focused on the area of the upper extremity. And in addition to my practice in orthopedic surgery, over the past couple of years, I've gotten involved in administrative work, and I am the director of the orthopedic service line for Luminis Health. So I spend some of my time doing administrative duties as well. And then on Mondays and Tuesdays, I go to the clinic My Monday clinic is in Annapolis, and my Tuesdays are in Odenton. I see patients usually starting from around 8 o'clock to about 5 o'clock, with about a 1 hour lunch break if I'm lucky enough to get that in between. So Wednesdays and Thursdays are my surgical days. And then Fridays, nowadays, I'm doing administrative work, which is sort of helping to run the orthopedic service with my partners, my administrative partners. Honestly, the best part, I know it sounds kind of cliched, it's helping people. I just had a morning, I had a high school student, actually a college student. He just graduated from Severna Park High School. He's now a freshman at the University of Maryland, and he wants to go to medical school, so he was shadowing me. And I was in clinic, and I got to take care of some basic upper extremity conditions and help answer patients' questions. And I also took care of some very complicated conditions, and I like those challenges as well. But really, it comes down to I really enjoy helping people. I enjoy trying to connect with people. As from a surgical standpoint, I love using my hands. I love fixing things. Surgery is very tangible. You get to see your results. But I think it's really the connection with folks and trying to help them.
As you can see, this orthopedic practice produces many different career opportunities. Luminis Health Orthopedics employs over 150 people. 63 of those people are healthcare providers. They have 7 different locations and are serving 3 different counties.
Thank you, students, for joining us today to learn more about all of the different careers that exist in medical practice. We hope that meeting these people today will help you to look at large businesses and consider which jobs or careers are available there. You may find something new that interests you. Thank you again for joining, students. Bye.
Bye.